It is very dangerous if you ignore these signs, if you are taking losartan, valsartan, temsirtan, and irbesartan. So any of these antihypertensive medication that belongs to the ARB family, you should not ignore these signs if you are having them. So what is ARBs? ARBs, they are called angiotensin receptor blockers. These are very effective medication. Apart from bringing down your blood pressure, it has other advantages. One, for many medications that cause kidney damage or reduces the kidney function, losartan helps to improve the kidney function, especially for patients with diabetes. Now have diabetic nephropathy. That is to say, their diabetes has caused a kidney injury or a kidney damage. Losartan helps to improve kidney function. So that's why many doctors will prescribe losartan for patients with high blood pressure and also have diabetes. For patients with heart failure, it helps to improve the heart function because it reduces the workload of the heart. And it also helps to reduce the risk of stroke. Despite the benefit of losartan and its family members that I just stated, it has its own side effects. And if you are having these side effects that I will mention, please do not ignore it because it could lead to a catastrophic outcome. Now, what are the side effects? Despite its various side effects, there are common side effects that I have seen with patients taking these medications again and again. So I'll be listing 4 of them, which is very common. First on the list is that losartan can cause dizziness. So if you know anyone on this medication that is not having dizziness after starting this medication, please, you need to see your doctor. If it is mild dizziness, some people might advise you to ignore. But if this dizziness is significant, it is severe, please see your doctor. In many cases, you feel this dizziness anytime you stand up from a sitting or a lying position. So what you need to do while waiting to see your doctor, there are some lifestyle changes that you need to make. One of them is that you want to stand from a sitting or lying position, please stand slowly so that the postural drop will not be so sharp. So once the postural drop is not so significant, your dizziness improves. Okay? Now, the second side effect, apart from dizziness, is that it can cause potassium to be raised. Once you start taking this medication, like I said, in lisinopril and its family members, losartan also causes raised potassium. That is why once you start this medication, you should ensure that you check your electrolytes frequently to see the trend of your potassium. Why I'm emphasizing on this is that if your potassium is high and you are not aware, it can cause what we call irregular heartbeats. And if your potassium is so high, above 7, it can even result to cardiac arrest. So it's important that you check your potassium after starting this medication regularly. The third side effect that you need to know is dry cough. You know, I talked about that persistent dry cough is a common side effect of lisinopril and its family. Okay? But that same cough can also be found in losartan. But the good news is that this side effect is not as severe as you find in lisinopril, and it's not as common as you find in lisinopril. That is why for my patients who are on lisinopril and they are having persistent dry cough that is making them uncomfortable, the medication I change them to is losartan. Okay? Because the cough is very mild and is not so common. The fourth side effect that is also common is headache. If you are having any of these symptoms, or 2 of these symptoms, or all of these symptoms I've talked about, after starting losartan and any member of its family like losartan, valsartan, temsirtan, please see your doctor. Just before I end this series, if you know that you are pregnant or you are planning to get pregnant and you are taking losartan, please let your doctor know because losartan is contraindicated in pregnancy. It can harm your baby as your baby is developing. Hope you've learned something today. Please like, share, and comment. Send this video to any of your friend or relative who is taking this antihypertensive medication.